Now, to help us understand what's going on, we're now joined by Dr. Mpho Maja, who's Director of Animal Health at the Department of Agriculture, Land Reform and Rural Development. Dr. Maja, thanks very much indeed for joining us, and welcome to the program.
Thanks, Peter, and good evening to the viewers.
So 56 cases, does that mean 56 farms? Or what are we talking about when we say 56 cases?
It's a variation between farms and deep tank areas. In our communal areas, we use what we call an epidemiological unit, being cattle that are constantly in contact with each other. We call that an epidemiological unit. So we count that as one per deep tank. So it's a combination of farms and deep tank areas, in total 56 years.
So this could be quite a lot of animals that are affected.
It is quite a lot of animals. And as you said in your introduction, in the 5 provinces, in Limpopo, KZN, Northwest, and 1 farm each in the Free State and in Gauteng. Yes.
All right, so we believe this started in Limpopo, and how is it that it spreads so widely?
Limpopo has our normal foot and mouth disease controlled areas where we normally do clinical inspections and vaccinations. And there was an incident in the Thulamela area that was picked, unfortunately, after it had occurred. And that is how it managed to escape from the Thulamela area through movements that we are still investigating to the Northwest province. We are also still investigating how it got to KZN, and in which area it was reported in May of last year.
All right. So what are you trying to do now to manage this?
What we have done in Limpopo and in KZN, the areas that are affected are being vaccinated to try and minimize the viral load as well as the spread of the infection to neighboring properties. And that is because those communities are communal communities and they graze together. So it's very difficult to contain those animals and minimize their movements and contacts with each other. In the Northwest province, we have placed those farms under quarantine, and the owners are advised not to move animals out of the area, into the area or through the areas, including KZN and in Limpopo.
How is this virus spread?
It is normally spread through live animals. Very rarely is spread through animal products. And that is why we are advising owners to please not move animals, especially when they see that they are not well, as well as buying animals of unknown health status. That is how it is effectively transmitted, through live animals.
So it's animal to animal. Human contact in between doesn't affect the scenario.
Humans can mechanically transmit it. Fortunately, the consumer is safe and would not get infected and would also not normally transmit it unless mechanically. For example, if veterinarians or animal health workers move from farm to farm without observing biosecurity measures, that way they can mechanically transmit it from one farm to the other. But otherwise, it's very rarely that people would transmit the disease.
And the only way to stop this is to find those animals that are infected, and they have to be culled, unfortunately.
What we have done, we are still debating and discussing the option of culling. What we do is there's a number of different control options. Culling is one of them. And in order to contain and bring the viral load to minimum as quickly as possible. The other options would be to vaccinate, other options would be to quarantine and control, especially where those other options would be properly managed. But yes, culling is another option that we are currently investigating.
The international community is always got eyes on things like this. What do we need to prove, and to prove quite quickly?
What we need to prove to the world is that we are on top of the situation and as quickly as possible. And that is why drastic measures would be required for us to contain this outbreak. So we normally communicate with trade partners to give them updates on our investigations, on our surveillance, and on our control measures. And that normally helps with regaining the export markets and confidence of our trade partners.
Is it quite easy to be certain and safe that only those affected farms are closed off, and that the other farms that might be involved in export can carry on? Or once KwaZulu-Natal is in trouble, does that mean every farmer in KwaZulu-Natal is in trouble?
I will answer the last one first. Fortunately not. It's just a limited area in KZN that's currently affected. The Mtuba, Nongoma, KCD area.
Yeah.
And we are advising farmers in that area to please not move their animals, because then they would spread the disease into the rest of KZN as well as the rest of the country. So with the first question, we are confident that we will be able to contain this, and that we caught it right at the beginning of the infections, especially in the Northwest. And as you have said in your introduction, unfortunately, an auction was involved before we could pick up infection in the Potchefstroom area. Fortunately, the premises where we had bought from that auction have been identified, they have been followed up. And so far, only 2 premises, one in the Free State and one in Gauteng, have been identified to have been infected. They are also under quarantine, and disease control measures are applied. So I think we managed to pick it up fairly early enough for us to be able to contain it.
And I suppose that, foot and mouth is not new. You've been in this situation before, so there's a lot of learning and knowledge in terms of how to manage this. My question is, how do we prevent these outbreaks, or is this just an inevitability that we have to prepare for, that from time to time we will have to deal with this?
We can actually prevent incursions of foot and mouth disease into the rest of the country. We normally have incursions into the area close to the Kruger National Park, which is our endemic area where we have buffalo that are permanently infected with the virus. And that's where we don't get surprised when we get infection into those areas. And we have permanent measures in that area to control, actually first to identify incursion early enough, and then to contain and to control it. In the rest of the country, we can, if we work together with industry, stop all the movements of especially animals from the Limpopo and parts of Mpumalanga area that are from the protection zone into the rest of the country. We will be able to contain this speedily.
So I've always thought foot and mouth was something that you see in cows, but it sounds as if a number of different animals can get it. Which ones are the most problematic at this stage in these outbreaks?
The biggest culprit is unfortunately also our biggest attraction in terms of tourism, and that's buffalo. We have buffalo in the Kruger National Park that are permanently infected. They cannot get rid of the virus. They are perpetual carriers. But outside of the buffalo, any animal, we call them cloven-hoofed. Those animals that have hoofs that have a cleavage in between. So that would be your cattle, your pigs, your sheep, your goats, and some wildlife species.
All right. Dr. Maja, we're going to leave it there, but we have every confidence that you're going to get on top of this and manage this on our behalf. Thank you so much for your time, and we wish you the best.
Thanks, Peter.
Thank you. Good night.